Welcome back to Phenomenal Health, everybody. I'm Grayson Foster, and I'm here with Dr. Scott Danoff, and we're running out of time, so we got a bunch of stuff we still need to cover. All right, let's talk whitening, because this is a huge issue these days. What do you recommend for your patients?
Well, everybody that comes in, one of the first things we talk about nowadays is whitening.
Right.
Very often in the past, we've gotten some crowns or laminates done on some front teeth, and as soon as we're finished, patients would say, all right, now I'd like to whiten my teeth. So that's really the wrong way of doing it. You've got to whiten your teeth first, get the right base behind it, and then you go on with whatever cosmetic work you want to do. There are different whitening products, of course, besides the over-the-counter stuff and the Zoom whitening. We use a product in our office quite a bit called Whitening for Life. It's a trademarked product. What it does is it kind of builds a little bit of relationship between the patient and the dentist and gets them to come in very frequently for their care, and it watches over them. They whiten their teeth at home with trays, and then every 6 months when they come in for their checkup, they get the whitening solutions free for life.
Nice.
So they won't have to pay for it ever again.
Wow. So once you have that perfect white smile, how critical is it to maintain that white smile, and also by avoiding periodontal disease?
Well, it's very important to take care of your smile in every way, with regular checkups, brushing, and of course flossing at home. Periodontal disease is something that you want to keep in check. It can lead to heart disease, and that's something that we've all read about in the papers. It's something that you want to be mindful of.
Of course. Let's talk implants versus dentures. How do you know what to do when?
Well, there's not that many people that are thrilled with dentures nowadays, and we all know that the longer a denture is worn, especially on the lower arch, the more bone gets destroyed. And as the bone gets destroyed, it takes away from the seat for the denture and for the denture in the future, so the dentures start to wobble. So we're putting implants in under dentures. We could put in conventional implants under dentures, which take 6 months to a year between the time you start the project and you have the implants under the denture, where the implants are holding the denture in. But we do a lot of mini implants now, where you actually place the mini implants in under the denture all in one appointment. So the day they get their denture is the same day we put the implants in and fit them into the denture right then and there.
Wow. Doctor, what are some of the latest techniques that you're using with respect to doing implants?
Well, the latest technique with implants was developed about 6 years ago. We actually can place mini implants into your ridge and have a permanent bridge that was pre-made, fitting right on top of those implants, and it all gets installed in an appointment of about an hour to an hour and a half, sometimes 2. And
how do you find that's really affecting your patient's quality of life once they do this?
Well, the quality of life is phenomenal. First of all, nobody wants to wait 6 months or a year to finish up, and if we could finish you up in the course of an hour or 2, that's an awful lot better. There's no removable appliances worn in the temporary. You just go straight to the finished product.
Now, what about in terms of financing? Do you work with your patients to try and help them get whatever financing they need to be able to do the dental work that they do need?
Sure. Well, we have a company that we work with that does financing for the patients that will give them, I think it's upwards of a year, interest-free, so they can stretch out their payments over about 12 months.
Nice. Let's talk about oral cancer. And I'm sure you screen your patients for oral cancer.
Certainly.
And this is very critical, isn't it?
It's very critical. In fact, the latest technology in that involves a machine called a Velscope. A Velscope is a special fluorescent light that looks into that you shine on the tissues, and looking through the lens of this, it actually fluoresces the natural tissues green, but any inflamed cells or any cells that are cancerous or precancerous don't fluoresce at all. They actually appear black. Wow. The phenomenal thing about it is that you can see through the tissues down below the surface. So where things normally would be seen to the naked eye when it gets to the surface, with the Velscope we actually can look down deep into the tissues before it even gets to the surface, so you're catching cancers even earlier.
Wow, and this is definitely something you want to be doing every 6 months.
Well, once a year. Once a year. It's similar to a pap smear or a mammogram.
Dr. Danoff, do you love what you're doing? What really keeps you motivated?
Oh, I absolutely love what I'm doing. The biggest motivating factor is handing a patient a mirror after we're done, and they see their new smile for the first time, and their smiles are from ear to ear, and it's just very gratifying.
Wow, amazing. You're changing people's lives.
It's absolutely, and we love it.
Wow. I have about 30 seconds left in the show, so I know you want to take a moment to talk about your website. What can people expect when they go visit your website?
Well, aside from the usual stuff you see on any website about the office, our website is more of an educational website. We want people to be able to go on and really find out what they can do with their teeth and see before and afters, and really get educated to what their problems are and what could be solving them.
Right. Dr. Danoff, thank you so much for being on the show.
Thank you very much.
Appreciate you being here. Thanks for watching this edition of Phenomenal Health. We will see you next time.